Well, I grew up in Indianapolis, Indiana, on the south side. I have a family that still lives up there. So I went to IUPUI in Indianapolis for a bachelor's in biology as well as a master of science in biology. And then once I completed that, I went to Loyola University in Chicago and got a Master of Arts in Medical Sciences. And then I attended Chicago College of Osteopathic Medicine in Chicago and graduated from there in 2010. I completed an internship in internal medicine in 2011, and then once I completed that, I went into active duty military service with the United States Air Force. I separated from the Air Force in 2017 with the rank of major, and then started my board certification process, my family medicine residency in Orlando, Florida, and finished this year in 2020. We really like the hospital. The other thing is, when I was young and Red Brush Park was still in existence, I used to come out here all the time as a kid and to Starve Hollow Lake with family and spend summers here. So there's just a lot of memories and stuff in this area for me, and it was just the kind of practice setting I was looking for. When I was younger, I was 5 years old. It was one of those, I want to be a doctor or a fireman or a policeman when I grow up. But then when I was 15 and that family member passed away, I was present when it happened, and I was helpless to do anything. And it really struck a chord with me. And I promised myself I was never going to put myself in that position again, where I couldn't do anything to help someone. So that just really affirmed my decision to become a physician. Primary care is, and specifically family medicine, is about, to me, taking care of the whole person. And I'm a DO, and that's one of our main focuses. So that's the main reason why I chose primary care. And I also like to have, close relationships with my patients, to be able to talk to them about their family, their kids, their parents, to be able to have those conversations. You can't really do that with, say, emergency medicine. They come in, you see them, and then they're gone, and you might not ever see them again. Same thing with surgery. You may have some continuative care with them, but it's not, from possibly birth until they're adults, which is what attracts me to family medicine, is to have that long-term relationship with patients. I'm not as serious as I look. I'm smiling now, but my wife always tells me that I come across like, people meet me and she's like, you need to stop looking like you're so mean or angry. And I'm also, I can be pretty sarcastic. So if you ask me a question, you might get an answer that you don't expect. But I'll try to stay in line the best I can. Eat right, try to get some form of exercise 3 times a week, even if it's only walking to the best of your ability, but don't push yourself to where you get hurt. Don't smoke. Limit the amount of alcohol intake that you have. No drugs whatsoever. And make sure that you do go see your physician, at least once per year, so they can talk to you about prevention things, check your blood pressure, make sure that that's fine. Things like, as you get older, need for colonoscopies, need for your breast exams, your mammograms, things like that. And also, please get vaccinated for anything that you need, especially the flu vaccine. And then when it comes out, get a coronavirus vaccine when it becomes available. Hi, I'm Dr. Wilson. I'm glad to be joining Schneck Primary Care, and I look forward to helping you meet your health goals.